Hi everyone. The topic for the today's presentation is renal transplantation. I am Sasikala, assistant professor, belongs to Medical and Surgical Nursing Department, working in Triple M College of Nursing. We're going to present you the topic on renal transplantation. After this presentation, you will be able to know the meaning of renal transplantation, list the normal functions of kidney, narrate the history of renal transplantation, identify the criteria and contraindication for renal transplantation, and explain before, during, and after care of renal transplantation. Let's begin the topic. The renal transplantation is a preferred treatment for the patient with the end-stage renal disease. It offers better quality of life and confers the greater longevity than the long-term dialysis. So what it means by a kidney transplantation or renal transplantation is a surgery done to replace a diseased kidney with a healthy kidney from a donor. Usually, this kidney may come from a deceased organ donor or from a living donor. The living donor can be the family members or other who are a good match may be able to donate one kidney for others. This type of transplant is called a living transplant. In that such situation, people require renal transplantation. So when it is started, who has initiated? Let's see the history of renal transplantation. In 1902, this first successful experimental kidney transplantation were performed at the Vienna Medical School in Austria with animal. And 1909, the first kidney transplant experiments were performed in humans in France using the animal kidney. Early 1950s, there is an innovation of medicine called cortisone. It's a cortisone-like medications were used to suppress the human body's self-defense system, resulting in some kidney transplant success. Earlier to 1950, there were many renal transplantation were going into rejection. Once after this cortisone identification, the rejection rate was less. And another milestone in the year of 1954, Joseph E. Murray and his colleagues at Peter Ben Brigham Hospital in Boston performed the first truly successful kidney transplant from one twin to another. This was done without any immunosuppressive medication. That's a point to remember here. So what is the criteria for renal transplantation? The major criteria is the patient with ESRD. What is ESRD? End-stage renal disease, where their glomerular filtration rate would have been less than 15 ml per liter. And in case of malignancy, hypertension, uncontrolled hypertension, diabetes mellitus, genetic diseases, polycystic kidneys, metabolic disorders, chronic renal failure. These are all the main criteria or indication for renal transplantation. Next, see about the contraindication. People with cardiac and pulmonary insufficiency, hepatic diseases, and concurrent tobacco use and morbid obesity puts the patients at risk for surgery. And immunocompromised diseases, especially the HIV people, are contraindicated to transplant. Now, let's see about the before transplantation procedure. So once it has been identified, the patient is indicated for renal transplantation. First step is finding a match. What is it, finding a match? A kidney donor can be living or deceased person, related or unrelated person. So transplant team will consider several factors when evaluating whether a donor kidney will be good match for the patient or not. And then some of the blood tests or some of the investigations will be carried out. First one is blood typing. It's preferable to get a kidney from a donor whose blood type matches or is compatible with the patient. That is very, very essential to look after. Second important thing is tissue typing. If the blood type is compatible, the next step is a tissue typing test called human leukocyte antigen HLA typing. This test compares the genetic markers that increases the likelihood the transplant kidney will last a long time. A good match means it less likely that the body will reject the organ. If the HLA matches good means the rate of rejection would have been less. That's the reason that this tissue matching is very, very essential. And next one, third one is cross match. The third and the final matching test involves mixing a small sample of patient's blood with a donor's blood in the lab. The test determines whether antibodies in the patient's blood will react against specific antigen in the donor's blood. This also they will check. If the reaction level is less, so the patient's rejection rate is also would have been less. Next, we will see about during the procedure, what are all the steps the doctors will be performing. First, the surgeon makes an incision in the lower part of one side of the abdomen and places the new kidney into the body. Unless the patient's own kidneys are causing complications such as high blood pressure, kidney stones, pain or infection, they are left in the place. The new kidney will be kept in the lower portion of the abdomen. Second point, the blood vessels of the new kidney are attached to blood vessels in the lower part of the abdomen. And third, the new kidney's ureter, the tube that linked to the kidney to the bladder, is connected to the patient's bladder. So this is how the procedure will be carried out. Okay, once after the surgery, what to be done? What is being expected from the patient? First one, the patient has to spend several times to a week in a hospital. Why? Because the doctors and nurses monitor conditions in the hospital transplant recovery area to watch for any sign of complication. And second point, frequent checkup till get recovered. After discharge from the hospital too, the close monitoring is necessary for a few weeks to check how well the new kidney is working and to make sure the body is not rejecting it. And third point, medication to the rest of the life. So this kind of a patient, rest of the life, they have to be on some kind of a medication called immunosuppressant drugs. Okay, so these immunosuppressant drugs help keep immune system from attacking and rejecting the new kidney. Additional drugs help reduce the risk of other complications such as infection after transplantation. So this is very, very important after the surgery. So what type of the diet the patient need to take? They have to eat at least 5 servings of fruits and vegetables each day, avoiding the grapefruit and grapefruit juices due to its effect on group of immunosuppressant medications. Having enough fiber in daily diet is essential, and drinking low-fat milk or eating other low-fat dairy products, which is important to maintain optimum calcium and phosphorus level. Eating lean meat and poultry and fish is very important. So this is how the renal transplant patient has to be cared after the surgery. Hope you are clear about it. So these are all the reference, book reference and net reference I had. Hope you are clear about the condition. Thank you.